Step 1. What is retinol? Retinol is a form of vitamin A that helps in reducing wrinkles, treating acne, evening out skin tone, boosting collagen production. It's one of the most powerful ingredients in skincare. Step 2. Who should use retinol? Retinol is ideal for people with acne-prone skin, early signs of aging, fine lines, dullness, those with dark spots or hyperpigmentation. Not recommended for pregnant women or those with extremely sensitive skin. Step 3. How to start using retinol. Beginner's plan. Start with a low concentration, 0.25% or 0.3%. Use only 2 times a week at night in the beginning. Apply a pea-sized amount after cleansing and before moisturizer. Always use SPF in the morning. Step 4. Retinol do's and don'ts. Do. Always apply on dry skin. Use gentle moisturizers. Apply sunscreen daily. Don't. Mix with exfoliants like AHA, BHA. Use with vitamin C at the same time. Overuse. It causes peeling or irritation. Step 5. Side effects and how to deal. Peeling, dryness, purging are normal in the beginning. Use hydrating serums and barrier repair creams. Give your skin time to adjust, 2 to 6 weeks. Step 6. Long-term benefits. Smooth, youthful skin, fewer breakouts, bright and even skin tone, improved skin texture. Thanks for watching. Please like and subscribe now.